Representative Delozier. Thank you.
Thank you, Mr. Chairman. I just broke the mic. We've been using it too much this week. Thank you, Madam Secretary, for being here. I have a question on House Bill 59 that was vetoed by the governor this October with the Human Services Code. And in working with many of the initiatives that were in that bill, we're working to provide better services and find ways to rein in costs and be able to get the services that are needed to many of the people that our government should be serving, those that need it the most. But that bill was vetoed by this governor. And I guess my question goes, there's many programs obviously offered by our agencies, and especially in your agency, SNAP, TANF, medical assistance. Why do some of the programs have a work requirement, but yet TANF or medical assistance that's not included in that?
So we do have, as you alluded to, a work requirement for TANF, and there's a work requirement related to SNAP. I think in terms of the extending such a work requirement to Medicaid, I think if we start from where we all agree, I think what we all agree on is that everyone should have the independence and sense of purpose and dignity that comes with working. And that's why, from the department's perspective, we have had as a priority and continue to have, with I think a renewed focus, a focus on trying to increase employment opportunities for all the populations that we serve.
Well, I will say, and I apologize, I have a short period of time. They're going to start cutting me off with the lights here. But that was when we debated the issue, the argument on the floor time and time again was we can't have people that are on medical assistance work. So I take issue with the fact that that's what the goal of it is, to have people, because we time and time again, and I support wholeheartedly the We Can movement, the ability to get folks with disabilities in the workplace, because just what you just said, that it gives people that validity that, yes, I have something to stand up for, but yet we're turning around, the governor's vetoing when we try to have that go into a program that should be. So how is that? That doesn't seem to be meshing.
Well, I think the issue is with Medicaid. Medicaid is not a welfare program; it's a health care program. So it provides health care to people. And I think the concern we have the majority of able-bodied, or close to the majority of the able-bodied population in Medicaid is already working.
And how many is that? Do you know what the percentages are?
Yeah, so we have about 942,000 non-disabled adults in Medicaid, and about 456,000 are working, almost 50%, and about 486,000 are not working.
Okay, and why isn't that the other? I guess that's my issue, is the fact that why are the other able-bodied? We're not talking about those that cannot. Obviously, there are many people in our state that need the assistance, and we have no issue with that. But more and more, why is it just with the whole campaign, like I mentioned, we want people to have that. We want them to be part of our economy. We want to grow what their abilities are. When we talk about the people that are not, but yet we're vetoing bills that would require this. So
well, I think that's what we agree on. We agree that we want everyone who's able to work to be working. I think the issue is that we know people experience barriers to working, and I think taking away access to health care is just going to add one more barrier. I think that's our concern. So we want to understand, I think your question was a good one about what do we know about the 486,000 people that are not working? We need to know more about that group so that we can understand why they're not working today and figure out what we can do to help address their barriers to getting them to a place where they can work. Mm-hmm. And that's what we're really focused on. So we're doing a couple of things. Can I tell you what we're doing?
Okay? Quickly.
Okay. Sorry. So first, one of the things we're doing is we're doing a deep dive into the Medicaid claims data. So we've got a contractor working with us to try to really understand through the claims data what might be going on with these populations, so we have a better sense of kind of where they're coming from. The second thing we're doing is working really closely with our MCOs on addressing social determinants of health, because we know that social determinants of health, things like housing, food insecurity, these are things that have a bigger outcome, or bigger impact on health outcomes than what happens in a doctor's office. So we've been working with the MCOs, and we even brought them together recently to say, we know you're doing a lot of things around social determinants. What else can we do around employment? Because employment and income, those are social determinants too. So this is an area that we are really focused on right now. I think, and frankly, it's an area we'd like to work with you on. I think we have a lot of things we can do to improve the programs that are available to help get people working, but we also need to acknowledge that people have real barriers to working, and if we're focused on addressing those, I think we'll get more people working.
And I agree. One of those, just to hit on one of those barriers in and of itself, and this has been one of my biggest frustrations with our state government for the years that I've always seen it as a punitive system, and we're trying to help those people get on their feet. We're trying to get them into that workforce. But as soon as they go over by $5 a particular threshold, whatever that threshold may be, immediately health benefits are taken away, daycare issues are taken away. So why are we not balancing that out to say if they are over by $5 or $500, that, okay, well, they don't get that $500, but they still get the rest of those dollars. Let the state bill come down while they're getting on their feet and let them prove themselves. Let them get out there. So that's another issue with barriers. I agree with you wholeheartedly. My light is extremely red, but just the ability to say that we do need to make sure that we're not punitive. Let's work to make sure that our system is helping them and not, hitting them over the head with one and saying go to work with the other. So I want to balance that out.
I think we agree on that. If we're not being punitive and taking away people's access to health care, I want to do everything we can to help get people to work. So
okay, thank you very much.